Time now for Health Matters. Lynn Szabo from Redwood Urgent Care. You have a handwritten sheet this week. What are we talking about?
Well, we're talking about the structure of the medical world in the United States and why it matters. It's kind of a boring topic, but it's really important as far as navigating through the tiers that are in medicine, and kind of explains why medical decisions are made in ways that the patient might not understand. A lot of it is tied to insurance, but really there's 3 tiers to medical care. The first one you guys probably have heard about is the primary care provider, and this is, we call this the medical home. And it's important to have a primary care provider, even though it can sometimes be frustrating and inconvenient in Del Norte, because people who have primary care providers have longer, healthier lives. That is data-driven, and I think it's important that we all live longer and healthier lives.
That's great. Just having somebody that you can talk to on a regular basis who might know your case.
Yeah, to check in with and to make sure all your healthcare maintenance is done, and make sure that they can help guide you through the more serious parts of the illness. Maybe they're in charge of the referrals if something needs more specialty care, that kind of stuff. So the answer to the question, who's your doctor? There should be an answer.
You should have an answer. I've been in situations where I didn't have an answer for that. Yeah,
absolutely. So it shouldn't be urgent care, even though it's more convenient to drop in and get things taken care of here. We can't. We're easy, but we don't have all the resources that somebody might need, okay? So the second one is what's the secondary care, and that would be like the local specialist. So in our community, that, for example, would be like Dr. Duncan for orthopedics, or before he retired, Dr. Davis for urology. And those doctors are important because they have expertise in certain areas, but they're not going to make sure that you're up to date with your immunizations or that your cholesterol is a normal level or anything like that. In the case of Dr. Duncan, they take care of like bone and joint problems. And in Dr. Duncan's case, he's even a little bit more of a specialized secondary care provider in that he specializes in hand, orthopedic care of the hand, which is cool because there's nobody else up here that does that.
We suffer from a dearth of secondary specialists.
We do, and that's actually an important reason why a lot of primary care providers don't hang around. We talk about how they think that there's not enough shopping for their families and stuff, but that's not really as accurate as you think. It's just that they feel like there's no resources up here.
Wow.
So, yeah, I know. It's kind of a hard problem to fix.
That is.
If you don't have the resources, and the resources don't stay around because there's no resources, it's kind of mind-boggling.
It's a chicken crossing the road sort of thing. But I've also never heard that explanation for why we have such a hard time keeping primary care physicians here, too.
Yeah, doctors in private conversations say that all the time. So the next one would be the tertiary care, and then usually these are associated with medical teaching hospitals, and these are the ones that you know from TV, like Grey's Anatomy and in-house, those big buildings with lots of glass atriums and people who can actually get an MRI in seconds, and these are the people who see unusual things all day long. And then they also are making the rules up for medicine that are going to be in play in about the next 10 or 15 years.
So we're talking to places like UC San Francisco?
Right. Totally cutting edge. However, you wouldn't necessarily go there for your mammogram.
I hear often with folks up here, too, when they're sent afield, that they end up there for lots of reasons.
Right. UCSF is a common one here, especially people who are on Medi-Cal because they have to stay in the boundaries of California for the most part. But if you have insurance that lets you go into Oregon, OHSU, Oregon Health Sciences University, totally amazing place.
It is, yeah.
And then where I went to school, Duke in North Carolina, a huge, big teaching hospital, lots of incredible medical minds. And I know when I was there, it was a long time ago, it was about 35 years now, but I was... they were doing quote-unquote experimental medicine on me, where I was part of how they define normal for echocardiograms before they started doing routinely on people, and electromyograms too.
Oh, wow.
So yeah, they take starving medical students and they use this as experimental.
So you were control in that?
Yeah,
in that instance?
Apparently I was. So anyway, that's kind of exciting, and that is really where some amazing miraculous medicine happens. But the primary care people are really where the medical home is, and those are the people that are charged with taking care of the local community so that they don't need to go to the specialists at the tertiary care level. But kind of also on the same, maybe a little bit in the same vein, the other side of that nickel is that you don't have to go to tertiary care if there's a talented local person that can take care of the problem that you have.
Okay, do you have an example of what a scenario like that would look like?
Well, we can go back to Dr. Duncan. What if somebody has a hand problem?
There you go,
You know,
yeah.
he's certainly a very talented hand surgeon. So we do have some local talent. We just don't have all the local talent we wish we had. So. The next thing is kind of often a special category on its own is the emergency room. So the emergency room is for life or death situations. It's not for convenience. And the average emergency room wait in California right now is 8 hours. And if you have to wait 8 hours, it's probably because you're not the one dying at the moment. Okay, so we got to really keep that in mind. People wait a long time, mostly because they're there for something that really could have been taken care of somewhere else. Okay, and it's not that the nurses are being mean and making you wait. It's that they're trying to save the life of somebody's grandmother or somebody's baby. So there are things going on behind the scene that you really don't see.
And is it true? I mean, folks who don't have insurance, who don't have, I guess, a history with this,
Right.
I mean, they're using the ER as a primary care physician. A lot of
Yeah,
times.
totally. And sadly, they're also using the ER as kind of disaster management because they haven't really been taken care of early on, and they present oftentimes in life-threatening situations. Like a friend of mine once who had no primary care person actually ended up in the emergency room a couple days before his death from lung cancer, and that was his presenting.
Oh,
It was the first time he presented to a healthcare provider.
Oh my gosh.
Yeah, it was really quite tragic. And certainly somebody could have helped him a lot earlier on. But, the emergency room is not the place to go because your doctor called in sick and you need a note to go back to work. And the other thing that's really important to understand in the emergency room is that if you show up and you call an ambulance and you decide to go there by ambulance because you don't have gas money, you will enrage the nurses, and they will not necessarily get seen faster because the nurses know how to triage people, and they'll still put you in the back of the line. Okay,
Wow.
so don't call an ambulance because you think you'll be able to get seen first. You don't want to be seen first. If you're not the one who's dying, then you're not the person who should be seen first. So
The E stands for emergency.
yeah.
Yeah.
But it's unfortunate because oftentimes people can't get in to see their primary care in a timely manner, and so they kind of default to the emergency room. And they have programs in the ER. I don't know if they're still doing it here because they have a new group of people in there, but something called the PIT, which is provider and triage, where they put usually a mid-level provider like a PA or a nurse practitioner who's trying to really quickly go through all the really easy stuff while the doctors are back there taking care of the people who are more gravely injured or ill. So anyway, so if you have to wait, consider that a good thing.
That's hard to keep that in your mind, but yeah, I think that's
I
an
know.
important point to make.
Yeah. So, people complain to me that they had to wait for 4 hours in the ER, and I'm thinking, wow, that was pretty fast.
Yeah.
So-
Boy, were you okay?
Yeah, I have worked in the emergency room here at Cedar Coast. It is a very difficult place to work. You're working with a lot of different kinds of people, a lot of people with mental illness problems, a lot of people who are actively taking drugs, and we appreciate the caliber of medical people that are taking care of our community there. So.
I have the community is rife with bad stories of bad ER experiences.
Right.
I've been to the ER a couple of times in the last 10 years. Kidney stone was one, and then
Right.
I passed out, and I didn't know why. That was another reason.
Yeah.
Never had to wait. Never had a bad experience. I've always been impressed with the care.
Yeah, and I'd like to actually give a shout out to the nurses at the emergency room. Oftentimes, if I have a patient here, and we have sent some people that were gravely ill, who started here, and then we sent them by ambulance or other transportation to the emergency room, I oftentimes will call and kind of pave the way with some information that makes it clearer as to why this person needs.
Oh, so they're not just showing up at the
No,
ER?
no.
Yeah.
When I send people to the ER, what I do is I'll talk to them here, and we do a process called triage, which helps me if I don't think I can take care of them here, it helps me to direct them to where I think they can get the best care. And what I do in my mind, since I've worked in the ER, is think about how would I be taking care of this problem if I had unlimited resources. And if I need resources that are only available on a timetable that an emergency room would offer them, then I'll go ahead and send them there. And oftentimes I can call the triage nurse, and since I've worked there before, have a provider-to-provider discussion, and I think it helps pave the way for some people.
Mm-hmm.
So I appreciate their care. Shout out to them.
Yeah.
I think they're doing a great job there.
Yeah, definitely. Let me add my story to the community stories. It's yeah, I was impressed. I was impressed with the kind of care and attention that I got at the ER, which seems different from a lot of anecdotal evidence out there. But folks might be laboring under the fact that they waited for so long and
Right.
go in kind of with
Right.
a
Yeah.
bad attitude that way.
Right. I think they don't understand the importance. It might feel like you're in a bakery and there's just one person after another, but really they're in the back room trying to save somebody's life.
Mm-hmm. Mm-hmm.
So if you're not that sick, you're not going to get that kind of priority attention.
Is there any truth to the full moon myth?
Oh, totally.
Seriously, really?
Seriously, the worst time to work in the ER is a full moon on Halloween, I would say.
Oh no.
Yeah, I spent one full moon Halloween in the Duke Medical Center emergency room, and it was crazy.
Wow.
It was just like Grey's Anatomy. It was wild, but we got through it.
Mm-hmm,
So,
mm-hmm.
the last thing is just a little bit about partnership and how it works, because I think people are surprised about that. So, partnership in this community. People are assigned to one of two primary cares if they have partnership, and one is the Sutter Coast Community Clinic and one is the Del Norte Community Health Center. Most of those patients go to the Del Norte Community Health Center. And so what happens is partnership is kind of an administrative arm that oversees Medi-Cal and helps, I guess, spend those medical dollars in this community for somebody that has partnership as their health insurance. And what happens is every month that somebody is on Medi-Cal, they are enrolled in a specific clinic, not necessarily assigned a specific provider, but a patient of that clinic, and that clinic is paid, I don't know exactly, but about X dollars a month to take care of that person and to take care of all the needs that they have.
Mm-hmm.
And so what happens is there's a little bit of rationing of more expensive medical procedures like MRIs and things like that. So because insurance being like it is, not only in partnership but also in other types of insurance, they will not allow us to order certain expensive tests, particularly I'm focused on MRIs here, without a certain procedure going through, and that procedure needs time. So let's say I'm insured by partnership. I'm a patient at Del Norte Community Health Center, and I fall off my mountain bike and I mess my knee up. And I come to urgent care, and it's decided that, there's no fracture, but maybe there's some soft tissue damage that requires an MRI to diagnose further. They won't allow MRIs to be ordered from urgent care or even the emergency room. So there's no point in going to the emergency room to try and get it. You have to go back to your primary and get your primary to order the MRI. And usually the primary will not do that right away. Usually they'll recommend physical therapy for a period of 6 weeks. And even though an x-ray is not the best way to look at a knee problem, they will ask that the person get an x-ray. These are a little bit stalling tactics because most knees will get better without the MRI. And some would argue you don't need an MRI unless you're really contemplating surgery.
Okay.
Although I would say, how would you know you're contemplating surgery unless you know what your diagnosis is? But anyway, so people kind of don't understand that. And if they can't walk around and they can't get to work, that's a big problem for them.
Mm-hmm.
But we need to understand that partnership, they're not at that level making medical decisions. They're not making decisions based on patient convenience. They're making financial decisions.
So how much does that get in the way of a patient's care?
All the time.
All the time.
All
So
the
seriously,
time.
that's a real concern. It is.
Right.
If you're on partnership, are you getting worse care or not as good, not the best care that you could get if you were in, say,
I think it
private?
depends on the circumstance. I think people in partnership get really, really excellent care as far as healthcare maintenance because the whole clinic there is geared to making sure that your cholesterol's okay, that your
Well,
sugars
and that's a
okay,
way
that
for
you-
them and to save money too. Is
Right,
that
and
maintenance,
down the
right?
line, that does keep people healthier for a period of time. But it's really frustrating if you've been assigned to one of the clinics, yet you don't have a specific doctor, and it's harder to get in. And so what we do in those situations is there's this great office and this great part of partnership where it's called patient services. I also think they might overlap a little bit with Open Door because it is located in the Del Norte Community Health Center building, and there are kind of liaisons between patients and providers, and with the goal to have patients get what they need in a timely manner and to navigate through the system in a way that kind of makes sense within the structure, but it makes sense for the patient. And so I really want to recommend that if people feel like their provider's not listening to them, not doing the tests they want, not getting to them in a timely manner, that they talk to those patient service advocates. And they also have ones that speak Spanish.
Oh, good.
So if there's people in the community that are, that's their primary language, these people, they can reach out to them, and they seem to have the ability to get people into appointments in a really timely manner, to get people kind of hooked up with the provider that seems to work best for them, and also to help people get the kind of testing that they think they need, not necessarily, tomorrow, but in a reasonable amount of time so the impact on the person's life is lessened.
So it's an advocate you could go and get on your side.
Yeah, it's totally great.
Wow, okay.
And we have somebody, a medical assistant here, shout out to Diana Madrano, who has worked for Open Door for a long period of time, and really she almost like knows all the backdoor numbers and all the people to talk to who can do things, and people that can speak, the appropriate languages, either Hmong or Spanish, and what resources they need to make the system work for them. And so we have a lot of people that come in here every day, and even though this clinic does not at this time see partnership patients, we're able to kind of steer them in the right direction.
So if I'm out there and I don't have a primary care physician and I don't have insurance, and it's been, I don't know, a couple of years since I've been to a doctor, where do I start?
Well, again, it depends on if whether you have a specific problem. I think if somebody's just what we call worried well, so somebody who would just be interested in a physical and what's my cholesterol and that kind of stuff, then I would start at the community clinic level. So this hypothetical person, might actually be qualified for a partnership or Medi-Cal. A lot of people are, and it's kind of surprising. And then they can get in and start their primary care journey and their maintenance. So this person does not have any acute needs, so they don't have to necessarily get in and, in a week or 2 days or something. But so they could be patient and maybe have an appointment in the next month or two, and then, bring their information and their questions in, and then kind of establish a relationship with a primary care provider, and then see. So that the next time when they do have an acute problem, let's say they got the flu and they got to get in quickly, then their path is already kind of cleared.
Sure.
Yeah. And they can get what they want in a more efficient mean. I do see a lot of people who have no primary care provider who report being sick kind of on and off for a couple of years and being frustrated because nobody really seems to help them. And I don't think they understand that the door to what they want is the primary care provider. So they should be able to answer the question, who is your doctor, with an individual name.
Wonderful.
Okay.
Yeah. Anything you'd like to add?
No, except I just want to give the heads up that the teen clinic is returning to Del Norte Community Health Center at their usual location in the CR campus. And we're looking at opening up probably the 11th of June, and it'll be every Tuesday afternoon.
Wow, okay. So future Health Matters, maybe discuss what will be happening there?
Or
do you want to go into it now?
Yeah, I have no real idea on that. So
Okay.
if anybody has a suggestion, I'd be willing to go for it. I was thinking maybe talking a little bit about first aid and what we should have in first aid kits, because I think that can be important, but I'm not sure that that's a whole segment. So I'm open to suggestion.
Okay. Well, I think, especially if the teen health clinic hasn't been around, hasn't been functional for a while, hasn't been responsive to the community, if that's going to change, it might be good to, talk about teen health concerns.
I would be glad to do that.
Wonderful.
Yeah.
Lynn Szabo, thanks again this is week number 8, by the way.
Oh, wow.
Yeah.
That's cool.
That is cool.
Right.
Thank you very much. Health Matters, Lynn Szabo, Redwood Urgent Care.